Welcome, everyone. Thanks for your patience. My name is Shan. I am the Drug and Alcohol Coordinator at Injury Matters. Welcome to the Alcohol and Older Adults webinar. We'll have two expert speakers this morning, Dr. Paddy Quinn and Joe Woodruff, to join us today to share their expertise regarding alcohol consumption and amongst older adults. I wanted to start off with an acknowledgement of country. As I said, my name is Shan and I'm the Alcohol and Other Drugs Coordinator for Injury Matters. Prior to opening this meeting, I'd like to pay my respects to the traditional custodians of this land, which always was and always will be Aboriginal land. I'm grateful to be born on Whadjuk country and raised my beautiful daughter Florence on this land, who has just turned 2 and started to be able to identify the warming of the season and the birds becoming more audible and active. I'd also like to extend my gratitude to all Aboriginal and Torres Strait Islanders, elders past, present and emerging. I'd like to acknowledge the lived experience of alcohol-related harm among individuals who may be in attendance this morning. The importance of carrying traditional cultural practices through language, stories, festivals, food and values is so foundational to everyone's identity. I am privileged to have the opportunity to coordinate and facilitate today's webinar with the intention to reduce harm to our community. So please feel free to share in the chat what land you're joining us from today. Just a few housekeeping things before we get started. With the exception of the presenters, if you could ensure that your microphones, they should be placed on mute, but if they're not, could you please make sure your microphone is muted? This will allow everyone to be able to hear the presenters clearly. We'd also love to hear your questions, so we strongly encourage you to please send them through in the chat box and we'll go through them at the end of the presentation. If you do have more than one person in the room with you listening right now, we'd appreciate it if you could let us know via the chat tab, just to let us know how many people are listening in with you. If you face any technical issues during the presentation, please write them down in the chat box and we'll do our best to help you. I do have Roisin to the side helping me today. Also, just to let you know, this webinar will be recorded. So, a little bit about us. At Injury Matters, we work with people and organisations across Western Australia to innovate and deliver injury prevention and recovery solutions. Solutions that keep people safer and healthier at home, at work and on the go. Our approach is as expansive and inclusive as our remit, which spans everything from road trauma safety to trauma recovery and falls to substance-related harm. As a not-for-profit organisation, we work with local communities, industry, government and our health, emergency and social service partners, drawing on the latest research, evidence and lived experience here in WA. That is to raise awareness of injury risks, consequences and solutions, prevent injuries through a range of education and support programs, support the recovery of people, families and communities impacted by injury and trauma, advise and enable local and national agencies and policy makers to make smarter, safer, more informed policy decisions to support the needs of the community we work alongside. Together we find and share injury prevention, recovery and policy solutions that keep everyone safer and healthier. Solutions that reduce the far-reaching physical, emotional and financial impact caused by injuries and trauma. So these are a bit about our programs. We have Stay on Your Feet, Road Trauma Support and No Injury. And today's workshop is brought to you by the No Injury program, provided by Injury Matters and funded by the Department of Health. The No Injury program provides ongoing networking, training and development opportunities to support the prevention of injury in WA. So injury is a significant public health issue in WA. More than 4 members of the WA community die to injury-related incident each day. Last year, injury was the leading cause of death for Western Australians aged 15 to 44 years and the third leading cause of death for the whole population. The leading causes of these fatalities were falls, intentional self-harm, and poisoning-related incidents. Each year, 1 in 4 adults report requiring treatment from a medical profession due to injury. So onto the webinar itself. There is no safe level of consuming alcohol and no guidelines regarding alcohol consumption for older adults. However, the Australian guidelines define risky drinking as consuming more than 10 standard drinks per week or more than 4 standard drinks in a single session monthly. Physical changes associated with aging, along with medication interactions, can increase older adults' vulnerability to alcohol-related harms. Many older adults are unaware of how physiological changes with age increase their vulnerability to alcohol-related harm. This limited understanding may lead them to underestimate the risks associated with their drinking habits. The impact of alcohol on older adults can increase the risk of falls, bone fractures, and other injuries. Patty will talk to the rate of consumption in older adults and why it's a concern in more detail. So alcohol is the leading cause of injury. It contributes to 20% of the overall injury burden in WA. Older adults are not the exception to this impact, especially given alcohol's interaction with age-related changes in metabolism and the increased presence of comorbidities. Older adults are vulnerable to alcohol-related injuries, including falls, road crashes, and poisoning. Some of the impacts of alcohol consumption impacting injury risk are an overall negative impact on an older adults' overall well-being, negative impact on and straining relationships, financial stress caused by alcohol use impacting their stability. Alcohol can also increase the likelihood of behavioural risk, diminishing inhibitions and increase in verbal and physical abuse. It is important to note that many older adults take multiple medications, which in turn increases the likelihood of harmful alcohol-drug interactions. So we are an ageing population in Western Australia. So not only do we have an increasing population in WA, we also have an ageing one. So currently about 15% of the state's 2.8 million people are aged 65 and over, and this is expected to grow and increase to 18.5% by 2031. This change is due to longer lifespans and the aging baby boomer generation. As the population ages, there will be a greater demand for healthcare, aged care, and services to support older adults. This shift requires careful planning to meet their needs and support their quality of life. As our population ages in WA, supporting older adults' health is a priority to ensure the quality of their life, minimise health costs, and promote societal well-being. This includes reducing harm from alcohol. So I'd now like to pass over to Patty Quinn. Patty Quinn is an emergency geriatrics registrar at Fiona Stanley Hospital. Now, if you let me know, Patty, if you would like me to share your slides or if you're happy to share the slides.
Yes, Shan, please, if you could share the slides for me, that would be great.
No problem. It's here. What is it called? Older alcohol use. Scroll up. Sorry. Yeah. Oh. Oh yeah, and that slideshow.
Hello, everyone. Thank you very much, Shan, for the introduction, and thank you very much for having me here today as part of this great talk. I might double up a little bit on a bit of what Shanna's really important information there about injuries and how alcohol influences them in WA. I'll just tell you a little bit about me. So I'm a bit of a giveaway. Paddy Yes from Ireland. I went to the National University of Ireland in Galway. I'm currently a trainee with the Australian College of Emergency Medicine, and in my current role I work at Fiona Stanley, and half my time I work with older adults in the emergency department and the rest of the time with whatever else the emergency department throws at me. So in my role, I see a lot of alcohol-related presentations and quite a lot of presentations related to older people as well. So today we're going to cover some facts about alcohol use in the elderly population, how alcohol affects elderly people specifically, looking at falls and alcohol-related injury in elderly people and other effects of chronic alcohol use, and some resources that are available for elderly people in WA who use alcohol, but I think this will be covered in more detail from our drug and alcohol colleagues later. So looking specifically at elderly people and alcohol, as Shan alluded to earlier, we've got an increasing population of people who are older. So 1 in 6 people in 2021 in Australia were over 65, and that's expected to grow. In 2016, most adults who were older reported having at least one drink. So most people at least were having a drink. And then looking more specifically, those over 60 were more likely to consume alcohol at a more risky level compared to their younger counterparts. In 2022 to 2023, those who are age 70 and older, they were the age group most likely to drink daily. So not just that they're more risky in their alcohol consumption, but more frequent. And it's that chronic daily use that really leads to a lot of the bad effects that we see with alcohol. 1 in 4 people who are between 55 to 64 and 1 in 5 who are over 75, they consume more than the 10 standard drinks that are considered risky drinking, and we'll look into that a little bit later. Alcohol is considered the second most harmful long-term substance in older adults in Australia, and it's no surprise that tobacco is the most harmful. Some specific risk factors for alcohol abuse in the elderly. So elderly people who have experienced bereavement, elderly people who've got depression, anxiety, other mental health conditions, people who experience pain. And we see this quite a lot in the emergency department, that people with pain and sometimes chronic pain use alcohol as a substitute for medications, people with disability, and also those who've had previous alcohol use. Looking at more detail about how alcohol affects older adults specifically, older people tend to be on multiple medications, and this is what we refer to as polypharmacy. This can cause a multitude of issues in that the alcohol in itself can cause further breakdown or metabolism of medications. And because of that, it can reduce how effective medications are. So by reducing how effective they are, they may not work for their intended purpose. And examples of this would be blood thinners for people who have irregular heartbeats or stroke. It also can cause interactions with the drugs and worsen their effects. So we have seen a worrying trend of older adults who are on medications for sleep and insomnia, medications like benzodiazepines, and alcohol and benzodiazepines combined can have really dangerous effects, including sedation, and they really increase risk of falls. Alcohol can also worsen an underlying health issue in older people. So older people may be at higher risk of having liver disease. And so alcohol is going to have a much bigger effect for an older person versus someone who is younger. And as we age, our body also changes. And because we've got decreasing muscle mass, increasing fat, as our composition changes, that affects how alcohol affects our body. And like Sian has alluded to, people sometimes don't have that awareness that although their body's changing, their drinking patterns don't. With older people, alcohol significantly increases the risk of falling, like at any age group, car accidents, and with suicide as well. Alcohol can cause a greater risk of fractures, and this is because of worsening osteoporosis. This happens in alcohol because with chronic alcohol use, we get malnourished and our bones become weak and brittle. Other longer-term effects include affecting other chronic health conditions, increasing a risk of cancer, and also affecting cognition and memory. Looking specifically, and this is from the Injury Matters 2024 Falls report, huge cost to the health service in that falls are a very significant thing that happens, 313 million. There's a really high frequency of falls happening. So every 17 hours, someone is dying from a fall in 2021. Every 16 minutes, someone is being admitted to the hospital. And every 12 minutes, someone's coming to the ED. And certainly within our role in our ED, we see a very high amount of people with falls. Looking at more specific injuries. So fall is a very significant event. It is 43.4% of all injuries that need hospitalization, and it is 42.9% of all injury deaths, which is really significant. Alcohol also increases your risk of falling, and even just falling from a standing height for an older person can lead to death or a very serious injury. Common injuries we see can be injuries to the head and neck, and I'll look into more detail specifically about bleeds on the brain. They can also cause limb injuries, and we see very commonly injuries to the wrist, the hip, and to the arm as well. All of these injuries which can really reduce people's independence and their mobility. And we also see injuries to the chest, including rib fractures, which can be devastating for an older person, causing pneumonia and punctured lungs. Looking at more detail in falls with alcohol use in WA specifically, so 6% of all falls in Western Australia in 2022 were associated with alcohol, and the true number was probably higher because this was relying on alcohol use just being recorded in a medical file. And the people who were admitted with a fall due to alcohol, they had much longer lengths of stay versus those who didn't. So when people fall, when they're older and they bang their head, this can have very devastating consequences. People who are older tend to be on medications that thin the blood for lots of reasons, often because they have medical conditions that require these medications. And so even falling from a standing height can cause a significant bleed on the brain. This image here shows what we call a subdural hemorrhage, which is a bleed into the venous space. And this can initially not have many symptoms, and then there can be progressive drowsiness, vomiting, and can eventually cause death if not treated. The unfortunate thing is that when older people experience these injuries, in many cases, they have a lot of medical conditions and are quite frail with advanced age, and they may not be candidates to have neurosurgery to treat these. And so this can often lead to very severe disability and death. A specific injury that we see very commonly that's quite significant in falls for older adults is what we call a neck of femur fracture. And this is a fracture to the very top of the hip bone. In the majority of cases, the orthopedic surgeons can repair these and fix these, especially if people are already mobile prior to the fall. Half of people who experience this type of fracture may not be able to live independently again. And even at 1 year, there is 30% of people have died within 1 year from this injury, even when there has been a repair. So looking again at the longer term effects of alcohol use, I mentioned before how it can affect cognition and memory. So as we age, you're at higher risk of cognitive impairment, dementia, and with alcohol use on board as well, this really increases your risk of cognitive decline. It also impacts people's ability to care for themselves and live independently. As at any age, alcohol use has a higher risk of developing mood disorders, experiencing social isolation, and maybe it's in the other way in return, in that people who are older often experience social isolation and turn to alcohol at home. And of course, alcohol use is linked with increased suicidal ideation and completing suicide. Alcohol also really affects chronic diseases. So things we often see in older people: heart disease, high blood pressure, diabetes, liver disease, just to name a few, all are worse with alcohol. And alcohol has been shown time and time again to increase people's risk of cancer. And we see this commonly in head and neck cancers, breast cancer, and cancers that affect the esophagus and the GI tract. This is linked with increasing and heavy use as a higher risk. Alcohol also affects metabolic processes in your body. And so people can be deficient in a vitamin thiamine, which can lead to the dementia associated with alcohol and other balance issues, as well as having osteoporosis of brittle bones. So these are some recommendations. Obviously, the first recommendation would be to avoid alcohol altogether. Like Shan has already said, there is no guideline or there's no evidence to say that alcohol can be consumed at any safe level. There has been some reports that maybe some moderate alcohol use may improve cardiovascular risk, but overall there is no benefit. Next would be to reduce alcohol intake. So the current Australian guidelines for alcohol use would be to say drinking no more than 10 standard drinks per week, or no more than 4 standard drinks in a single occasion for healthy men and women. By drinking at this safer level, this has been shown to reduce the risk of alcohol-related injury. The next most proven thing to reduce risk of falling was exercise. Also reducing the dose and the number of medications that older people are on has been shown to really reduce the risk of falls. And then, although bone health strategies don't reduce your risk of falling, they can reduce your risk of severe injury from falls. This would include things like vitamin D, calcium, and certain medications to increase bone strength. So specific to WA, there's always your local GP, and I would stress that it's very important that if you know anyone or you yourself are experiencing issues with alcohol use, it's very unsafe to suddenly cease alcohol without medical support. It can be life-threatening with seizures, with withdrawal. So I would really advise involving your local GP or drug and alcohol specialist. There's also the drug and alcohol support line for people who are using alcohol and also for their families. Next Step is widely available throughout the metro area in various locations. And there's also the Southwest Community Alcohol and Drug Service that's specific for Southwest WA. And always there is the local emergency department, which we're very fortunate within Fiona Stanley to have a fantastic drug and alcohol team. And from my experience, they are available in the other metro emergency departments as well.
Thank you so much, Patty. If anyone has any questions for Patty, feel free to pop them into the chat. We will get to the questions at the end. If Patty's not around, I'm sure that I can follow up with those questions for you. But thanks again to Patty for presenting that information. I'm now going to pass over to Jo from Hollyoak. I just want to confirm, Jo, whether or not you would like me to share the screen again with your slides, or if you're happy to share your slides.
I'll actually share mine, Shan, because I had to do a
Brilliant.
quick rejig. I realised there was a slide out of order this morning. So I'll share mine if that's all right.
Yeah, awesome. Can I? So then oh, you're all good, Jo. Go ahead.
So can you see that now, Shan?
Yep, I can see. All good. Thanks, Jo.
Thank you. So thanks, Sian and the team at Injury Matters for inviting me along today. What I'm hopefully going to share through the next 15 minutes is just how alcohol and other drug prevention can look in community. We've done a lot of work through the Wheat Belt, and we have a team of staff across WA and doing alcohol and other drug prevention in the community. And hopefully we'll inspire people to do some more prevention locally to help, particularly regarding older adults. I'll just quickly add my acknowledgements. I'm actually sitting on Wilman Noongar Budja today, so it's an honour for me to be sitting here, and I'll acknowledge our local Aboriginal and Torres Strait Islander people and pay our respects to elders past, present and emerging. And in the work that we do, and I do a lot of work collaboratively with our suicide prevention coordinators as well, is we do like to acknowledge lived and living experience. So to acknowledge those that we have lost or who have been bereaved and impacted with lived experience of alcohol and other drug dependence, mental ill health and suicidal ideations. And we do like to acknowledge the voice of lived experience and honour those voices by allowing them to guide the work that we do undertake. For those of you who aren't aware, so I work with Hollyoak. Hollyoak is an alcohol and other drug and mental health counselling service. We have offices in Vic Park, Midland and Wheat Belt. So we hold the community alcohol and drug service contracts across those areas. We also provide suicide prevention and postvention in the Wheat Belt, as well as aftercare coordination. In relation to alcohol and other drug prevention, we have an alcohol and other drug prevention coordinator in the Wheat Belt, which is Jess Daniels, and I will refer to some of the work that she does as well. So I held that position in the Wheat Belt until I moved into the AOD Community Prevention Service, and Jess followed after me. So we've done a lot of work collaboratively together. The AOD Community Prevention Service is a new service funded by the Mental Health Commission, which started last year, in July of last year. So it's a brand new service which we've been rolling out since then. So we have staff members in the Kimberley, Midwest, Goldfields, Southwest and Great Southern. So for those of you who are working in those areas, please feel free to reach out and I can give you the contact numbers of the staff in those regions. So what is prevention? I went to get a definition because a lot of the definitions in relation to prevention and health prevention is very disease kind of focused. But I did find this one which kind of resonated a little bit better with me, which is that it's any action taken to keep people healthy and well, which is really what we focus on all the time, is about health and well-being, and to also prevent and avoid the risk of poor health, illness, injury and early death, which is everything we think about in relation to alcohol and other drugs. And so we're really aiming to look at supporting people to be as healthy for as long as possible. If we narrow that down to alcohol and other drug prevention, it's really about improving health and well-being of individuals, but also families and communities, because alcohol and other drug use doesn't just impact that person, it impacts their families and communities as well. So we're really looking at preventing or delaying the onset of alcohol and other drug use, and then protecting against risk and reducing harms associated with that. We don't get a big piece of the pie as far as prevention dollars, but we do know it's an effective way of funding health prevention, in that every dollar invested at the other end will save $14.30. That was from the Department of Health and Aged Care this year in their budget. I've heard ranges, but we do know that if we invest in prevention, it really does save us in the long run. So hopefully it's something that we can all be involved in more moving forward. I just wanted to allude to these very quickly because it's kind of how I structured the presentation, is really to think about the frameworks that we use with alcohol and other drug prevention. The Ottawa Charter, anything to do with health promotion, is a big part of what we do and guides the pillars that we're involved in. We work predominantly with the developing personal skills and strengthening community action, predominantly, but also I guess the other three we have parts in that we do reach into, and creating supportive environments, I suppose, is another part that we've always got in the back of our mind. The other one is the harm minimisation framework, which comes from the National Drug Strategy, looking at those 3 pillars of demand reduction, supply reduction and harm reduction. So those 2 frameworks we have in the back of our mind whenever we're looking at doing prevention activities in community. They are always at the forefront of what we're trying to achieve. So I've gone through and thought about everything that we do across our regions as far as alcohol and other drug prevention and tried to align them to all of those 5 pillars, just to give you a bit of an idea about where you may be able to look at doing some more work if you're interested in doing some alcohol and other drug prevention, particularly related to older adults. Public health or building healthy public policy. This is a lot about taxation and legislation, which we don't have a lot of input in, but we can do advocacy. So we all have an opportunity to advocate for older adults in this space. Public health plans, the state public health plan, or the new one, is in draft at the moment, due to be completed by June next year. And then all individual local government authorities then have to have their own versions of public health plans by 12 months after that. The draft state public health plan does have harmful alcohol use and misuse of pharmaceuticals as some of their priorities for prevention. So we try and work with local governments to really promote incorporating alcohol use and misuse of pharmaceuticals as prevention activities that they could incorporate in their plans, and in some situations support them with the developing of localised campaigns and activities to support that. We also have input with the development of some other community-based strategies. I've got some examples there, such as the age-friendly community plan, which the Shire of Pingelly developed, community wellbeing plans, which I will talk about a little bit later. We also had some input into the senior strategy into their consultation workshop. So that there are the opportunities if you're working with older adults to have some input into public policy. And then we also take up whatever opportunity we can to sit on local stakeholder working parties and forums. We have one in the Wheatbelt, which is the Wheatbelt Human Services Managers Forum, which has an Ageing Well and in Place working group. And we advocate for alcohol and other drug prevention all the time there, because a lot of the stakeholders are sort of more tertiary based. Reorienting health services, obviously the Injury Matters program, the Alcohol and Other Drugs pilot project fits into here as far as increasing motivational interviewing skills and screening tools. So that's drawing away from tertiary and trying to put more efforts into that preventative space. I've included a picture there of an infographic that Jess did in the Wheatbelt. This is a child and young people infographic, which is looking at providing an opportunity for an easy to use flowchart about where you can refer people to across, local services. And Jess is in the process of developing one for older adults. It'll be Wheatbelt specific, but it's a good opportunity as an example of what you might be able to do in your individual regions. I wanted to throw this one in, even though this is an alcohol-focused webinar. I did want to mention the take-home naloxone project, because often a lot of older adults might be mixing, as Patty mentioned earlier, mixing alcohol consumption with their pain-relieving medications, which may be opioid-based, and so that significantly increases the risk of overdose. So naloxone, the Take-Home Naloxone project is a federally funded project which provides naloxone free of charge for anyone who is at risk of overdose from opioids, or anyone who may be coming in contact with people who may overdose from opioids. So this medication helps to reverse the symptoms of an overdose or any adverse reactions to opioids. It only lasts for 30 to 90 minutes. So there is a risk that if it's a significant impact, that it may need to be used again, but it hopefully buys some time for the emergency services to get there. So if your organisation would like to be involved in that project, please get in contact and we can put you in the right direction. Strengthening community action. This is where we do a lot of work, is that we're working with community members to develop localised prevention activities specific to the concerns they may have in their community. And older adults is one that is coming up a lot as our population ages. As part of the AOD Community Prevention Service, we do community response plans. And then the AOD prevention coordinators and suicide prevention coordinators do community wellbeing plans. CWPs are just bigger versions of the community response plans and more stakeholder focused, whereas community response plans is really a link between stakeholders and community members. But it's about developing strategic frameworks or strategic plan of alcohol and other drug prevention activities. They can link in with their public health plans and help LGAs to address AOD prevention for their community. So there is a good opportunity for us all to work together as far as that, those public health plans as well. This is where we start to get into more of the fun stuff. Education and training, particularly for stakeholders and organisations that are working with older adults, is a big part of what we can do, and we can tailor presentations to individual organisations. There's just some examples there, regarding presentations on alcohol and prescription medications, the impacts on chronic disease, and responsible service of alcohol. If we really want to knuckle down to, men's sheds and sports clubs, those sorts of things where alcohol is a big part of that. Responsible service of alcohol is a really good harm minimisation strategy that we support. We also do a lot of work trying to promote and advocate for the implementation of programs such as the Good Sports program from the ADF and Stay on Your Feet, obviously, for injury matters. So we try and promote them as much as possible. This is a program that we've done locally in the Wheatbelt that I was really involved with, which was actually done for young people, but I would love the opportunity to do that for older adults because I can see some real benefits of this. It was the development of a small wallet card which had crisis lines, websites, phone lines. So anyone who had concerns about alcohol and other drugs or mental health and wellbeing, there was a list of places that they could go for support. And then what we used, that card could then be used to get free entry, which we funded through the program, to the pool or the gym, or to go to exercise classes, or to go and play squash, any of those sorts of healthy activities. We also embedded some art and culture programs, bus transport. So if you're out of town, we incorporated some bus transport. So what it was about allowing young people in this situation to develop connections with their peers and also support service providers in order to help with social interaction and education, being more aware of what support services were out there. So I think there's a real opportunity for communities to potentially look at implementing that for older adults as well, because access and peer support, loneliness, social connections is also all really important for older adults as well. So there's an opportunity there. One of our groups down in Albany is also doing an alcohol-free events program booklet. For a lot of people who are wanting to cut back on their alcohol consumption, alcohol is embedded in our culture. It's part of births, deaths, marriages, everything that we do pretty much often has alcohol. And for people who are wanting to cut back, that can be really challenging. So they're pulling together a program booklet of all the different alcohol-free community events that are happening in the community, and incorporating some educational information, tips and tricks on how to cut back, harm minimisation ideas, support services, both local, online, website, those sorts of things. So that's all being pulled together in a booklet, and hopefully will be printed in the next week or so, which will be exciting to see. And this is a big one for what we do. It's about developing personal skills. So that's really about information, health literacy, education about harm minimisation and staying healthy in place. These are just some examples. Jo Drayton, who's our suicide prevention coordinator, and Jess worked collaboratively to do social prescribing events through the Wheat Belt. So they were luncheons and morning teas, incorporating fun games, interacting activities and presentations, educational presentations. There was also a booklet that was developed which incorporated a lot of information and tips about staying healthy and connected, pain management, sleep, alcohol, prescription medications, naloxone, falls prevention. So everyone got to take away that booklet. So that was a very successful series of events in the Wheat Belt. We have community events where we can incorporate some AOD prevention in a fun way, having a quiz, educational material, campaign material, expos. They're all opportunities to bring stakeholders together to share information with older adults. And we also do a lot of work developing resources because there's not a huge amounts out there for older adults. So we've done there's some examples there on the slide about how to reduce consumption. So the top 10 hits for week to week. We've also got a short-term one as well. And there's another one there about standard drink sizes, being more aware about how many standards is in a drink. Community programs we support, Stay on Your Feet. I know Jess is doing a presentation about managing prescription medication to support a Stay on Your Feet program that's being run in one of our communities. We've also done some work with Department of Local Government, Sports and Cultural Industry as well regarding alcohol and other adults. So that's again about providing information about standard drink sizes, the NHMRC guidelines, pain management, all of those sorts of things, incorporating some of the risk factors for older adults. So just to sort of bring that all together, prevention can look anything from small things, just promoting support services. There's a fridge magnet that we have there that we've developed specifically for older adults, and that might be all you do, or you have a flyer. Or you can start to increase the size depending on, your budget and capacity. It might be newspaper articles, it might be promoting awareness days or incorporating some email signatures into your workspace. Promotion of campaigns, there's the Alcohol Think Again campaign, What's Your Poison, which is another one about health and the impacts of alcohol consumption on health and wellbeing. So there's campaigns that you can do there, having community events and awareness days, and then building up to your bigger projects like community response plans or having stakeholder workshops and something like a wallet card project. So there's a whole range of things that you can do if you've got capacity and interest to do work with older adults. I think it'll be a really rewarding project to work through. So hopefully that's given you some ideas of what you might be able to do at a local level. If you are in any of those regions that we talked about and you want to do some collaborative work or need some input and support, please reach out. My contact is there. Jess is obviously in the Wheat Belt and she can support you as well. So thank you very much.
Thanks so much, Jo. I'll just get my slides back up. Like Roisin has said, if you've got any questions, to pop them in the chat box now. Patty, I can see you're still there. So I've got a couple of questions for you if I can ask those if possible.
Sure. Apologies, there's some work happening here, so if it's a bit noisy, I do apologise.
Oh, good. Thanks for sticking around. There's a question here that says, are there any specific signs or symptoms of alcohol-related harm that are often overlooked in older patients?
That's a good question. So I guess subtly it could be things like change in mood, change in personality, increasing irritability. That might be if there's an overlap of alcohol with memory issues. One of the things that we refer to as a screening tool for alcohol is the CAGE questionnaire, and components of that would be if you notice that someone is irritable when you ask them about their drinking, if they have to have a drink early in the day to try and minimize the effects of withdrawal from alcohol, they can often indicate that maybe there is, you know, a bad pattern of alcohol use. And other subtle things like, you know, bruising, injuries, and of course we can all bump ourselves off things. And as we've mentioned, older adults can be on medications that can thin blood, but they may be all subtle hints. Sometimes as well, it's the more you know, social things. People aren't taking care of themselves. You've noticed that maybe they you know, aren't taking care in their appearance, taking care in you know, around their home in terms of you know, how the appearance of the home is. You know, if you're someone that attends people within their house, they may all be indicators that you know, self-care has taken a hit as well with alcohol use.
Thanks, Patty. There is one more question here, and it's, are there any specific considerations or protocols for handling older adults with alcohol withdrawal symptoms in the emergency department?
So I'm not a drug and alcohol specialist, and in specific situations, we do refer to our drug and alcohol nurses, who are an incredible resource. Usually how we manage alcohol withdrawal is by using medications such as benzodiazepines. The reason for this is that as we drink alcohol, the receptors for those get down-regulated because the body is so used to it being there present all the time. And so the benzodiazepines, although I did mention earlier that when they're used in the community, they can cause harm in a controlled environment in the hospital, and sometimes even on discharge for some days. We use those medications to reduce the serious risks of alcohol withdrawal, and that would be namely seizures.
Thank you. Thanks, Patty. We've got a couple of questions for Joe. First one is, what is the easiest way to locate alcohol and drug services available in my local area? So you mentioned prior there was a great resource for the wheat belt. Is there similar for other regions?
Each region, I'm really pleased that you asked that. Each region has a alcohol and other drug counselling service, a CADS, Community Alcohol and Drug Service. So there's one in every region. So they would be your first port of call. They would, I can't actually speak for each one of them to say have they specifically got a resource, but I imagine that they probably would, and they'd be able to steer you in the right direction. The other place to go would be to the Mental Health Commission website, because they also have a list of all the community alcohol and drug services across WA, and their website also has connections to other drug and alcohol counselling services. Hopefully that will give you a few port of calls to start your search.
No, that's awesome. Thank you, Joe. What have you found to be most effective and have positive outcomes in your service regarding alcohol and older adults?
I mean, I think a lot of it is about just raising awareness, because for a lot of older adults, they don't necessarily, or I haven't been made aware of the impacts that as they get older and the physical changes that happen from that, that they're if they continue with the same amount of alcohol consumption, it's going to have greater impact day to day because of the physical changes that happen with aging and reduced muscle bulk and all those sorts of things. So I think raising awareness is good. And I think a lot of them have just sort of formed a bit of a habit. I remember speaking to one lady who said that until we actually did the presentation, she didn't realise that, oh, actually every drink that I'm having with my husband in the evening is adding up over the whole week. So a lot of it is just about raising those awareness. But loneliness is another big thing. And I think the work that we've done as far as bringing people together, and there's a lot of work happening in the wheat belt about social interactions and increasing opportunities for older adults to come together, because in the regions, particularly if they're out on the farm and those sorts of things, they're getting separated from community contact. Bringing people together has been really impactful for a lot of older adults in community, and I think that's really important out in the regions where they are often separated by great distances. So that's a lot of the positive feedback that we're getting is from some of those programs.
Thanks, Jo. We just had a bit of a technical difficulty there. Thanks so much. I just wanted to quickly acknowledge Patty and Jo for giving up their time. We really appreciate it. Again, if there's any other questions, please send them through to me. I'm just going to pop up a little slide that you can give us some feedback on this webinar. I just confirm that you can see that. Perfect. I'll leave this up for a second and you can hopefully use your phones, and takes a couple of minutes. Would really appreciate the feedback. Whilst I leave that up for a little bit, there is another slide that follows this, and my primary role in Injury Matters is to actually coordinate a pilot project that we have next year. They are a set of 4 workshops being presented to allied health professionals, and it is using the Assist Lite in combination with motivational interviewing. So Associate Professor Robert Ali and Steve Alsop will be presenting these in-person workshops, and I will just pop to the next slide so that you guys can scan the QR code there. You can also head to the Injury Matters page and you will find it under programs, and it's the Older Adults Preventing Harm from Alcohol and Other Drugs. I think what would have become hopefully quite obvious in this workshop this webinar this morning is that there is a lack of resources and assistance out there for older adults, particularly when it comes to alcohol and other drugs. So these workshops next year is to hopefully fill that gap. I will just go to the next slide, and they are some upcoming training opportunities we have with Injury Matters. We have another webinar on December 3rd and a public health pre-election forum on December 5th. And then next year we have the workshops happening in February. You can go and register for those workshops now. They are all live. So if you are an allied health professional that works with older adults, these workshops are for you. Other than that, there are some contact details here if you want to reach out and contact us. But if anybody doesn't have any other questions, we will wrap up for this morning. Thank you all for joining us. And again, thanks so much to Jo and Patty.